This is a right clavicle with the lateral end and the medial end. This is a right scapula with the medial border, the lateral border, and the superior border. You also have the superior angle right here and the inferior angle. We have the spine and the supraspinous fossa and the infraspinous fossa, along with the subscapular fossa. This is the coracoid process and the acromion process. And here's the glenoid fossa. And also you have the suprascapular notch right here. Right here is a right humerus. You have the head up here, the anatomical neck goes all the way around, the surgical neck. You have the greater tubercle and the lesser tubercle with the bicipital groove. You have the deltoid tuberosity, the medial epicondyle and the lateral epicondyle, along with the trochlea and the capitulum. Right here you have the coronoid fossa and the radial fossa, along with the olecranon fossa right here. Right here you have a right radius. You have the head and the neck. You have the radial tuberosity and the styloid process. This is a right ulna. You have the trochlear notch right here and the radial notch right here. You also have the coronoid process right here and the olecranon process. And here's the styloid process right here, along with the head of the ulna. This is the head. Here you have a right hand. You have the scaphoid, the lunate, the triquetral, the pisiform. Right here you have the trapezium and the trapezoid. You have the capitate and the hamate. Right here you have the metacarpals, which are numbered 1, 2, 3, 4, 5. And then you have the phalanges, which go 1, 2, 3, 4, 5, with this being the proximal and this being the distal. And this is the medial. And the thumb is different because it does not have that medial phalange. It only has the proximal and the distal. So you have the proximal, distal, medial phalange, the metacarpals, and then all of your carpals right here. Here's a pisiform carpal right here, loose. Here you have the hamate that is loose, carpal. And here you have the scaphoid carpal. That's the scaphoid right there. This is the right pelvis bone. You have the ilium, the ischium, and the pubis. Then you have the iliac crest, the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. You have the iliac fossa right here. You have the ischial spine right here. You have the superior ramus, the inferior ramus, and the ischial ramus. Then you have the ischial tuberosity right here, the acetabellum right here. You have the obturator foramen right here, the pubis symphysis right here where they connect. You have the greater sciatic notch and the lesser sciatic notch right here. And that's it. This is the right femur. You have the head, the neck, the greater trochanter and the lesser trochanter with the intertrochanteric crest and the intertrochanteric line. You have the gluteal tuberosity right here and the linea aspera right here. You have the medial condyle and the lateral condyle, along with the intercondylar fossa. And then right here you have the medial epicondyle and the lateral epicondyle, and you have the patellar surface. This is a right patella, and you can tell by pointing the apex away from you and the base towards you, and putting it on the surface, and it leans towards the right. So if you just put it down, it leans towards the right. So that's a right patella. This is a right tibia. You have the medial and the lateral condyle with the intercondylar eminence. And then you have the tibial tuberosity right here and the anterior crest right here, along with the medial malleolus right here. This is a right fibula. You have the head up here and the neck. Then you have the shaft, and this is the lateral malleolus down here. So this is a right foot. You have the calcaneus, the talus, the navicular, the cuboid, and then you have the lateral cuneiform, the medial cuneiform, and the intermediate cuneiform. You have the metatarsals that are right here with the base and the head, and then you have them numbered 1, 2, 3, 4, 5 from medial to lateral. And then you also have the phalanges right here. You have the distal, medial, and proximal phalange, and the hallux only has 2. It only has a proximal and a distal. It does not have the medial one. Then you also have the medial arch, the lateral longitudinal arch, and the transverse arch that goes across. Here is a calcaneus bone, loose, a talus bone that is loose, and a loose navicular bone.